A very good morning to all. I appreciate your attention and patience for a few moments. I am Tulja Kisi, a nursing teacher working as an assistant professor at Maharajas Nursing Campus, Institute of Medicine, Tribhuvan University, which is the largest university of Nepal. Today, I am here to present briefly about the findings of a review study entitled Active Learning Strategies for Nursing Students. The key highlights of my presentation includes the mentioned areas, starting from brief introduction of the study, need, objectives of doing review, the methods that was followed for gathering relevant studies, major findings, main conclusion, and cited references. Starting with the introduction of the study, teacher-centered lectures is one of the most widely used methods for teaching and learning worldwide. It makes a learner quite passive during class sessions. Active learning strategies is the process of education where students become extensively engaged in learning directly. It deeply stimulates the learner for a higher level of learning activities such as analysis, synthesis via various activities such as reading, writing, group discussion, etc. For students, active learning strategies have been shown to promote better retention and application of new knowledge than listening to passive information only imparting lectures. Active learning strategies comprise various types of activities such as group work, role playing, presentation and debates, simulations, and many more. Teaching clinical skills is an important part in educating nursing students in a complex healthcare environment. To hone them with various theoretical and practical skills has become a major challenge for many nursing educators. Adopting active learning strategies help to inculcate an active role of students for class as well as clinical learning activities. Using active learning methods not only enhance the communication and clinical skills, but also the quality nursing care for good health outcomes of the clients. Concerning the need of the study, nursing students need to apply theory which they learn in class into the clinical practice. However, students find it quite difficult to practice the skills taught in classroom in the real world. With the use of several active learning methods, it enhances the retention level, enables students to perform their skills confidently in classroom and the clinical even if they are not fully expert. This strategy places the student at the heart of the learning process, favors critical thinking and the ability to ask relevant questions where they are doubtful and make decisions accordingly. Hence, providing a set of strategies for maintaining and enhancing the academic engagement of nursing students has become crucial for quality nursing education and practice. The specific objectives of this review was to analyze the scientific evidences regarding the use of most effective active learning methodologies used for educating the student nurses as well as the obstacles in adopting them in classroom and the clinical settings. Regarding methods, this is a systematic literature review study which is characterized by an approach to generate clinical and teaching best evidences with help of available literatures. In regards to methods, it involves identifying and defining the problem or topic, that is active learning strategies, conducting the literature search for both qualitative and quantitative studies in various sites, and assessing the applicability of data from studies. The population intervention and context, the PICO framework, had been used to ensure the comprehensive and bias-free literature source. The population P involved nursing students, whereas intervention I involved those strategies used for active learning methodologies, and context CO was related to nursing education. Results were synthesized with the help of relevant literatures at the last. Talking about the results, they have been generated after the analysis of 20 selected articles. There was predominance of qualitative research than quantitative. Among the active learning strategies cited, a simulation was the most effective strategies followed by problem-based learning. However, some other strategies such as case-based learning, concept maps, role-playing, and scaffolding written papers were found to be efficacious too for the active involvement of students in the teaching and learning activities. In regards to obstacles, students were dissatisfied mainly with the ill-prepared faculties, inadequate logistic support, and unpreparedness of some of their peers in the group assignments. Also, lack of technical advice from the teachers also contributed for their disappointment on active learning pedagogy. To conclude, simulation and problem based learning were the most significant active learning strategies which encourage these and place the student nurses as an active agent of knowledge, resulting in active participation and learning as well. They boost the self-confidence of students, thereby building their capacity to deal with any type of learning experiences. Having inexperienced teachers, less motivated peers, and shortage of structural support were the major obstacles linked with creating negative impact of active learning on the performance of the students. Here are few references cited for this review. I sincerely appreciate your attention for listening to my presentation. Any suggestions are welcome. Thank you so much. Have a great day.